let's talk about AV blocks. Welcome to Waveform Warriors episode 3. So as we all know, the conductive system of the heart consists of SA node, AV node, bundle of His and Purkinje fibers. The impulse which originates at SA node travels through all of these channels, ultimately to the ventricle muscles or ventricle myocytes to depolarize them. And this is the fastest pathway. And any block in this pathway will result in either delaying or non-conduction of the impulse, which was generated at the SA node level. It takes a certain amount of time for the impulse to reach the ventricles, and it is called a PR duration, from the beginning of the P wave to the beginning of the Q wave or the R wave if there is no Q wave present. And it is 3 to 5 small boxes or 120 to 200 milliseconds. The QRS duration is the amount of time taken for ventricles to depolarize, and it is 3 small boxes or 120 milliseconds when the impulse is getting transmitted through normal channels. But if somehow the impulse is not getting transmitted through SA node to ventricles and ventricles take over or generate their own impulse, the QRS will widen or will prolong. It will be more than 3 small boxes or 120 milliseconds. There are 3 types of AV blocks. In the first degree heart block, the impulse is slowed as it passes from SA node to the AV node, but all the impulses are transmitted. So on the ECG, PR will be prolonged more than 5 small boxes or more than 200 milliseconds. In the second degree type 1 AV block or Mobitz type 1 AV block, the PR will be progressively prolonged and there will be a non-conducted beat or a missed beat where there will be P but no QRS complexes, and the cycle repeats itself. And since it happens in cycles, the P wave number is usually 1 more than the QRS complexes, and it is given a name based upon this. So like in this example, there are 3 P waves and 2 QRS complexes. So this is a 3:2 AV block. In second degree type 2 or Mobitz type 2 heart block, the PR duration will stay the same, but there will still be a missed beat, and then the cycle repeats itself. And majority of the time, the QRS which is conducted is usually a little bit broader. The third degree heart block is also known as a complete heart block because there is no impulse getting transmitted from atria to the ventricles or SA node to the ventricles. So the ventricles take over the role of generating their own impulse, and this is called an escape rhythm. So the atrial rhythm, which is the P waves, will be regular, and then there will be another rhythm which is the escape rhythm, which is usually much slower than the atrial rhythm, and the PR interval will be variable as there is no relationship between the two rhythms. This is the most serious type of heart block as these patients may go into cardiac arrest and they require usually immediate pacing.